Welcome to the Accidental Experts podcast. I'm your host, Bryce Hamilton. I'm a licensed clinical social worker and a child and family therapist. I have been in practice for over 15 years, and I'm also a mom of 4. So I know the challenges both professionally and personally. I'm so glad that you're here today to grow your parenting toolbox. Please come as you are and be ready to learn. My goal is to make you the accidental expert so that you can raise healthy humans. Hi, everyone. Welcome back. I'm so excited to welcome Dr. Lori Boyajian-O'Neill back to our show to talk a little bit more in depth about concussions and the questions that you guys had sent in. We are answering with her today. So thank you for everybody who sent a question. We're so excited to get these questions answered and to kind of take a deeper dive into concussions. With that, let's get to Dr. Lori.
Thank you.
Yes. We had so many questions about this. So we're going to kind of dive in a little bit more of what people are wondering and lingering from our first conversation around concussions. You
Very
ready?
good. Yes.
Let's do this. Okay, so I think one of the questions is what started your interest in this and concussions, and what's your background around here?
So I'm board certified in family medicine, always had an interest in sports medicine, and therefore attained a certification in sports medicine. So for almost my entire career, I've done sports medicine, and in the last 25 years, really exclusively sports medicine. So that involves being team physician for various club teams or high school teams and some professional teams. And it also involves clinic work and seeing patients in the clinic. And as concussions became more and more evident to us in the medical community and obvious to folks in sports, I began to see more and more patients with concussion in my clinic. And so this began then a great interest of mine in concussion, how to manage concussion. I'm not a neuroanatomist. I'm not a neuroscientist researcher, but I'm a clinician. And how best to recognize concussion and manage concussion. How do you get a patient from symptoms to back to their full lives, to a full recovery, what best methods to do that. And it was just very interesting to me. And then more recently in my clinic, I only exclusively see patients who have concussion.
Yeah, which is fantastic. We need more people like you who are really diving into the research and know all the best measures to take to help people recover as much as possible. Love it.
It's very rewarding.
Yeah, awesome. Okay, so we talked about in the last episode what the potential long-term side effects were. Can you, I think maybe what parents are wanting to know more about in this is, how do we respond to those potential long-term side effects? So maybe if we can kind of review what the long-term side effects are of having even one concussion, but several. And then how do we help manage this potential with our kids and making decisions about, do they play sports? Do they, do different activities? Do we let them drive by themselves?
Mhm, mhm. Well, first and foremost, about 10 to 15% of patients don't make a full recovery. So they may not have significant symptoms. They're just not themselves. A lot of times this manifests in difficulty with memory, focus, concentration, maybe a little distracted, symptoms that we attribute to attention deficit disorder.
Mhm.
And then they may have longer the prolonged symptoms related to mood, maybe more irritable or sad, more on edge and anxious. And so these are folks on one side who've not made a full recovery, but they're fully engaged in their lives. They are at increased risk for concussion in the future. And but those are folks who may manage themselves just on their own, make adaptations in their lives. There are other folks who are not made a full recovery, who have chronic headaches, for example, and maybe they have to be under the care of a neurologist for chronic headaches, which can actually be horrific. And maybe they're missing work or school a few times a month because the headaches are bad. And so you have patients who on the one end of the spectrum make a full recovery, on the other end of the spectrum don't make a full recovery, and within that cohort, within that group of folks who do not make a full recovery, They can have significant symptoms, or they can have symptoms again that they can manage themselves and apply some adaptive strategies so they get through their days and rewarding days and feel good about themselves, etc. The longer term, when they're having symptoms that require intervention, this could be anything from a neurologist taking care of headaches to mental health professionals helping them with chronic anxiety that may have been amplified if they had anxiety prior to the incident, or may have developed as a consequence of the brain injury. I tell my patients, it's all in your head. It's all in everybody's head. That's where the brain is. And when the brain is injured, there can be sequelae. And although we work very hard to make a full recovery, not everybody does make a full recovery. And some of the aftermath may include some anxiety, maybe depression, that type of thing. And so when we're talking about folks who haven't made a full recovery, we're talking really about multidisciplinary approach to care, and that is related to their symptoms and the conditions that they've developed as a consequence of the traumatic brain injury. On the other end of the spectrum of folks who have not made a full recovery, you have folks who have later on developed dementia and including chronic traumatic encephalopathy. And that's really a grave diagnosis and one that requires really intensive management to just to optimize day-to-day life.
What does that look like? What would we see symptomology of that condition presenting like?
So whereas patients who just have a concussion, the concussion has just occurred, you have these symptoms like headache, dizziness, lightheadedness, light bothering, sound bothering, maybe some changes in vision and sleep and mood. Those folks who have long-term sequelae, those folks who are exhibiting signs of CTE, behavior changes are often in the forefront of their own complaints, the forefront of what their family and friends see. They might have headache, they might have dizziness and balance problems and those other things. But what really brings them in is not that. It's the changes in behavior, erratic behavior, sometimes violent behavior, such as lack of motivation, behavior related to signs of depression, being more withdrawn, being not able really to kind of manage their affairs, which could be paying bills or managing their social schedule, that type of thing. And what you see consistently when you get reports from family and friends is just this change of behavior over time that just worsens.
So can you get CTE from one traumatic brain injury? Do we know enough yet to know, does it have to be repeated trauma, or what do we know?
I think the preponderance of research related to CTE is related to repeated impacts to the head. And these impacts may not rise to the level, any single one. They may not rise to the level of a traumatic brain injury. It may not rise to the level of concussion. But you picture somebody who's heading a soccer ball day after day, year after year, decade after decade. And you picture somebody who's in football practice. They're just practicing linemen, linebackers, running backs. Linebackers and running backs are in football the positions that carry the greatest risk for concussion. And so when you have the long-term impacts, just the going through normal football drills, for example, day after day, year after year, and you have these over time, all of these impacts, some of which may have been concussion, but most not, just glancing blow to the head, etc., just as part of what we would consider to be normal course of football, then over time that adds up and the brain doesn't respond well to that, which intuitively makes sense, right?
Yeah.
Like any of our mothers would say, well, that can't be good. But as more and more research comes out, we understand the effects of these long-term impacts. It's one of the reasons that there's been recommendations for flag football until high school to decrease the number of years that somebody is subjected to just normal, what we would call normal sports-related day-to-day impacts. And so what you see then is typically folks in their 40s or 50s who exhibit symptoms, but CTE has been diagnosed as young as age 18. So we know that this is not exclusively a diagnosis of those later in life. That behavior changes that are hallmark of CTE can occur much earlier. A lot of times, it's difficult to, if you're a parent, it's difficult to parse out. Like, this used to be how my son or my daughter was, but they're different. Is this just adolescence? Is this just, young adult behavior? Or is this something, even more sinister than that? And so it's just hard to get a handle on that if you're family and friends, and what you see is this person who used to be one way, who's now another, and getting worse. And that could manifest itself in a series of jobs. They can't maintain jobs, maybe alcohol or a substance use disorder, those types of things where that would be considered to that behavior would be out of character for that person.
Well, and I think maybe that speaks to just the importance of like asking, right? Like if you are concerned, right, and you know that they're, especially if there's a sport related thing where they have had concussions, or maybe they haven't, but it's a very rough sport, right? There is a lot of contact involved, that you maybe get curious about that part. And I know that there's no physician out there who, if you come in, well, hopefully there's not, come in and you say, hey, I'm concerned about this. Help me to understand. Is this something that is typical, like expected behavior, or is this unexpected? It feels unexpected for me. It feels out of character. Can we look into this? What do we need to do? And sometimes you might be dismissed. And if you really feel strongly about it, I think parent gut, especially mom gut, is often right on, right? We may not know why, but we know something's not quite right. And trusting that part and pushing through, even if you're not being heard by that doctor, finding somebody else who will listen and talk to you. And maybe it's not the thing, right? Maybe it isn't something that we need to be worried about. But if you have that nagging feeling inside of you that something isn't quite right, find somebody who will listen and explain to you why they think it's not that, or why they think it is that, based on how you're presenting.
That's absolutely right. And that goes for anything, right? Whether your shoulder's bothering you, you can't get a right answer, or whether you have some behavior problems, or, this person's not right. One of the challenges that parents have is that oftentimes this behavior is manifest after their child is older than 18 or 18 and older, right? They're adults and they can make their own decisions, and that makes it difficult. We don't have so much control. You and I talked earlier about, perceived control over our kids. But when they become adults, that's even less. And so, you can run into situations where the person themselves may feel like they're fine. Their behavior's fine. They can rationalize their behavior. But then other times, and you see this in heartbreaking notes that folks have left, like, I know I'm not right. This is not me. And then that despair. But that's on the other end of the spectrum of folks who have not made really a full recovery. And I think a lot of times too, people have symptoms and have had symptoms for years. Maybe that's dizziness or headaches, and just not in general sought out proper treatment to improve their day-to-day life, right? To improve their quality of life. So there's a lot out there that we can do, and research is enlightening us all the time. And at some point, relative to CTE, we'll be able to make those diagnoses earlier, and then offer treatment earlier, and comfort, I think. Sometimes there's comfort, even if it's a bad diagnosis, or a particularly concerning diagnosis. Just knowing is helpful. it helps friends and family, and it helps that patient come to grips with what they're dealing with. Um, I've had instances where we might get advanced imaging. It's not going to change anything that we're doing clinically, but if there's a problem with the brain on advanced imaging, patients be like, "Oh, at least I'm not crazy," right?
Mhm.
Like,
Mhm.
who told you were crazy? It certainly wasn't me, right? We
Mhm.
know you have a concussion.
Mhm.
You have some changes on the brain. It's not going to change anything we're doing. It's not going to change our treatment plan, but they feel like, oh, okay, I'm vindicated.
Yeah.
Yep.
Yep. And that's so important because often we do feel quote unquote crazy, right? Like you might have a diagnosis, but you are like, I just keep coming back to this and I feel like that's not getting better, or it feels like something nobody else is struggling with, or I don't have a full understanding of concussions or anxiety or whatever. And so just being able to like be like, oh, yes, that's the diagnosis. This all makes sense is almost giving the permission to explain where they're at.
Right. That's
Yeah.
exactly right.
Yeah. Okay. So this is a good segue into what are you seeing in the crossover between mental health and concussions? I know I see this in my clinic, right? But I would love to hear what you're also seeing.
Well, patients will come in and they will either volunteer front and center, or if I ask them, they'll say, I'm more irritable. The
Hmm.
word irritable comes up all the time of all ages. Um, we were speaking earlier, you and and I said it's just very uh, enlightening for me when teenagers who, as you know, who have a reputation for being irritable, especially with their parents, will say like,
Hmm.
"Oh no, I'm irritable. Like whatever I was before, it's worse now." Right?
Hmm. Hmm.
And so, but we're not robots. I'll say to we're not robots.
Hmm.
We are human beings and we respond emotionally. Why wouldn't we? We're
Yeah.
not Spock. And so I expect you to be um, sad if you can't play whatever sport you're playing. You know, it's not a surprise to me that you're nervous or anxious because you're struggling through school and you're worried about your grades. We'll work all that out. But we live here. And as I say to my patients, it's all in our head. That's where our brain is. It's not in our liver. We're not having trouble with, it's not a heart disease. This is a brain injury. And so everything the brain does can be amplified. Everything the brain does can be adversely affected
Hmm.
by the brain injury, depending on location and the nature of the brain injury. And so I will assure them that their feelings are validated, that they've earned their feelings, they've earned their emotions, they've earned their sadness because they can't go here or go there or play this or play that or work. They've earned that, and our goal is to navigate them through. The best remedy for all of that is to get them back to how they were before the incident,
Yeah.
get them back to them. But the reality is we can't do that with everybody. Not
Hmm.
everybody will make a full recovery.
Yeah.
And so this is where we rely on, number one, recognizing this. So is this just normal? It's been a few weeks after the concussion. They're a little on edge. They're nervous. Maybe they're going to lose their position in football or soccer or softball or basketball because they're out with an injury, and that makes them anxious.
Hmm.
Maybe they're nervous about work, losing their job, which would be the worst, right? And that's
Yeah.
completely understandable. So the goal here is to get them completely recovered, but you can't all the time. And so that's where we're recognizing that this is now a problem. Like we're 3 months in and they're still having trouble getting into a car or
Yeah.
riding in a car, or we're still struggling. We're struggling with the recovery of the concussion, and that has amplified the anxiety. So we really, really need to talk about how we can approach that. Who who do you go? Do you have a counselor currently? Is this part of your history? And if you don't, might we might we point you in that direction?
Hmm.
Because I think this would be helpful. You know, you don't want to kind of live in that world where you're so anxious or having panic attacks and that type of thing.
Yeah, it's
And
miserable.
for the most part, patients are receptive.
Yeah.
At the point at which I'm offering this, they're like, wow, yeah, I can't go on like this. And I'm really speaking of the emotionality of it. It's bad enough, the headaches and the dizziness, but then that just adds insult to injury.
Yeah. Well, and I think that, I mean, sometimes we can manage the physical stuff, but the emotional stuff too is, I mean, the physical can be debilitating, but it's like the emotional stuff will like show up
Mhm.
when we least expect it or in the worst moment, right? Where we have like a reaction to something and then that damages or impacts our relationships, right? So it's like we also, then it's like it's this trickle down effect, right? Where it can cause so many
Mhm.
negative side effects, I'm sure. And I bet that you also see people in your clinic that had concussions or maybe it's something more like CTE where it's like you're having just brain impact, right? Like these impacts that you aren't maybe aware of and you see them as like an adult and their partners or friends or family are saying like they're so irritable or whatever and maybe there isn't an awareness. Does that happen?
It absolutely does. So there's one thing to say, like, boy, I just don't feel good in my own skin, right?
Mhm.
There's another to say, this is really affecting my relationship, whether it's my best girlfriend, whether it's my peers at work, whether it's, I lashed out at the 15-year-old at the local drive-through who gave me the wrong order, life stuff, right? Doesn't that happen
Mhm.
every day? And it is also enlightening when they come in with friends or family because they'll be like, oh yeah, and then they'll tell you a story. So how is it affecting their relationships? And they will see it. Like when you really, we don't want to live in that space. None of us do. And when you
Mhm.
ask about it, then here it comes, right? This and that, and let me tell you about this, and the siblings don't want to be around them, and they're parents, we have to be around them, but we don't really want to because it's so onerous, et cetera. Um, and so when you walk somebody through, so tell me about that. I hear you. And then, okay, I have some ideas to help.
Mhm.
Let's try some counseling, maybe medication, and maybe other methods, right?
Mhm.
Meditation, et cetera. But by and large, they're receptive to that. I had a patient in yesterday who said, my sister used to have anxiety attacks all the time. Now, my patient is my patient because she has concussion. And she said, and I used to tell my sister, just stop it. This is what she says to me. I used to tell her, just stop it. But now she herself, from the concussion, is having panic attacks, high anxiety on a day-to-day basis, and panic attacks. Now she sees it completely differently.
Mhm.
And is very receptive to go into counseling. But I think the first step is not dismissing that and not treating that as a kind of a separate entity because it is affecting their interaction with pretty much everybody except their dog on a day-to-day basis, right?
Mhm.
And so I think when we approach it like that, this is temporary. You're in vestibular therapy. You have special glasses. We've got you in speech. We're doing other things, but let's make this piece of this easier for you on a day-to-day basis. They tend to be very receptive and appreciative of the efforts of the mental health professional that they're seeing. Oh, it's been so helpful.
Yeah.
Uh, and I think if we present it as I do, like, look, I think as you get better, you'll see your anxiety will improve. But some patients are pretty miserable for months. That's the truth of it. And when
Mhm.
you feel like you can't get out, you're in the deep cave and there is no way out, that is despairing. And you keep telling them, like, we're going to get there. This is not as good as it gets. This is not as good as it gets.
Mhm.
But when you wake up every day with a headache and you're dizzy and you have trouble reading and you have to reread because your eyes are everywhere and you're basically miserable every day, somebody like me saying, I'm telling you, this is not as good as it gets. Some days, you know, that's good to hear. And other days you're like, I don't see it, right? I don't
Mhm.
see my way out.
Yeah.
And that's where we have to provide that help and not see it. I tell my patients, and not see it any differently than if they had liver disease or had heart disease or an injury that required other therapy. Not see it any differently. I really assail this this separation of mental health from everything else. In the world of concussion, it's not only the primary brain injury, but it is that. But the primary brain injury can affect sleep. Well, if you never had a concussion, but you have disordered sleep, you can have mood problems, which I'm sure you know more about than I do, right? And the brain controls sleep. And so a lot of patients have trouble with sleep. So it just amplifies it. You have a primary brain injury, but then sleep is affected. You may be in a situation at school where you're maybe taking a test or you're having to think about some intense homework assignment. And you're slower, and here comes the anxiety. I'm not going to do well on the test, or I'm slower with this. What? And we know that anxiety then feeds on itself. It's all interrelated. But by and large, as symptoms improve, as the patient improves over time, the anxiety improves. We see some depression, for sure, but at least at the beginning and even lingering is the anxiety.
Yeah.
Stress of it all.
Yeah, it is stressful. Totally. I think life is just stressful. We have the opportunity to have anxiety at any time, right? And we
Right.
need anxiety because it also helps us stay safe. But when it's impacting our daily life, that's, where it becomes one of those things where it's not just like a situational thing. I'm nervous about a test, right? Or I'm nervous about this game, or I'm nervous about whatever, or I'm panicking about this. I forgot my homework. It's this overwhelming, almost always feeling, right? And that can be so hard to manage on your own. So definitely seeking out mental health support, and in terms of probably a licensed counselor in some way, right? Somebody with a license that really understands this, versus it being something that is just somebody who knows something about something, right? Like I think knowing
That's
that there's
absolutely right. As a physician, I only refer to licensed therapists, licensed counselors for sure. I think we owe that to our patients. Others might, dispute that. That's how I practice, and that's the reason I practice that way, because I want them to get the best help that they need, the best care that they deserve. And so I only refer to licensed mental health professionals. I think I have a duty to my patients for that.
Yeah. Absolutely. I think that's great because I think I can speak to that of like, we have the ability to diagnose something, right? And diagnosing isn't always necessary, but when you look at insurance, it is. But also sometimes with having the right diagnosis means you get the right treatment. And I think that part is so critical, whether you're looking at strep throat or you're looking at anxiety or ADHD or depression or right PTSD, like you need the right understanding of what's happening, getting to the right root of what's happening, and being able to do the right care.
That's absolutely right. And I have some patients who have their concussion from a car accident, and so getting back into the car or driving like they used to. They might drive around their neighborhood okay, but by God, they're not getting on the highway. It's too much for them, and that's understandable. But when that really, as time goes on, impacts their life, well, we need to get them to a licensed professional who can help them with that particular area, right?
Yeah.
If that's their the focus of their anxiety, then we need to take care of that. We need to address that. And then sometimes it's just a generalized anxiety, and again, I am oftentimes it's in folks who never had anxiety prior. Or never had a depression. I mentioned to you a little bit earlier in the previous about a 22-year-old who kind of sought me out. She'd had symptoms for 3 years, lives in kind of a rural area. I mean, to her credit, like, I'm going to try to get better. I'm going to try to get somebody who will help me, right? She'd been to a couple physicians, and she said, and her friend, also kind of confirmed this. They kept trying to diagnose as a primary diagnosis, as a standalone diagnosis, bipolar or depression or anxiety, and it kind of ignoring the fact that she had a traumatic brain injury that included a brain bleed. And so, it goes both ways, right? I need to recognize the mental health stuff, but on the other hand, I'm sure that there are folks who come in. We were talking about CTE. Their prominent complaint often is behavioral, and what's the underpinning problem there, right?
Yeah.
Yeah.
Yep. Yeah.
It
I
takes
think,
all of us.
yes. Yeah. And I love your brain works like mine of like, I want to get to the root issue. Like, what is causing this? Because if you don't, then you're not going to have the right outcome because you're not treating the right problem. And so it sounds like you are curious in your profession too, to figure out like, what is the underlying issue so that we make sure that we're treating all of the things that need to be treated.
Right, right. I tell my patients, anxiety, a lot of my patients will say, I can't think. Like, I'm not sharp. I'm struggling. I have to write down every single list of tasks, and then I get easily distracted and all of this. And at the same time, most of those folks have anxiety. And I'll talk about anxiety as kind of a thief, as a saboteur of our thinking. And I'll say, nobody in their right mind says, I have a big meeting today. I hope I have a good anxiety attack, right? I hope I have a big test today. I hope I have a good anxiety, because it's a saboteur. And so as it's all interrelated, like if we can make inroads with speech language pathology and improve thinking, then anxiety diminishes, right? Anxiety improves. If we have a licensed mental health professional and they're helping with the anxiety, like how do I cope with a big meeting or tests or things like that? So it's all interrelated. And as we start parsing out um, um, and improving their varied symptoms, because the brain does everything, then we see just in general their mental health improves.
Yeah. Okay, so what do you think the narrative maybe around concussion should be? What would you love, as somebody who primarily treats concussions, what would you love that narrative to be?
I would love that people understand that not everybody makes a full recovery. And if somebody is still struggling, believe them, whether you see it or not. If they're operating a brain that is different from what they operated 2 years before their accident, then believe them and show grace. I think that again, the misconception is that everybody makes a full recovery in a couple of weeks. There's really no treatment for concussion. You just kind of monitor and move on. I think that when there is other associated symptoms or injuries. For example, if I were in a car wreck and I had to have shoulder surgery, or I had a laceration to the scalp, if I had other overt injuries, then it's easier for people to understand sometimes, I think, that, oh, okay, boy, that was a pretty bad wreck. They had to have shoulder surgery and they had a big laceration on their scalp. But a lot of times there's no overt evidence of trauma. And for those patients, this silent injury becomes more isolating for them. People don't understand. They don't understand what I'm going through. I'm doing well at work, but it takes more effort for me to do well at work. I'm keeping my grades up at school, but it's harder for me. And here comes the anxiety and the despair, and just not being heard by family and friends who may not see that struggle overtly. And then for others, they overtly see it. This is not my friend. This is not my spouse. This is not my mom. This is not who they were. They're different. We can't do things like we used to do. And if there's one thing with concussion, I would say that recognize that not everybody makes a full recovery. In fact, 10 to 15% of people do not. That's a lot. And so how do we show grace and support to those folks? And it's day-to-day stuff. As I randomly, not for this podcast, but I randomly pulled out one of my favorite cups this morning from Brain Injury Association. I'm a big coffee drinker. And how do we show grace? We might be behind somebody in a grocery store and they're just a little bit slower. But for them, it's victory to go to the grocery store.
Mm-hmm.
You might be behind them in the drive-through and they're just a little bit slower maybe in making their order. But that is a victory for them to do that. They have to gather their thoughts, maybe write it down. I want, 3 tacos and a burrito. I have to have time to kind of sort out my credit card or my method of payment at the grocery store. Maybe they're just a little bit slower at the gas station, but those are victories. And how do we take a deep breath societally and show grace? Just take a deep breath. It's probably not going to take 1 or 2 more minutes. In your whole day, it doesn't matter. But in that moment, we tend to rush, and they feel that.
Mm-hmm.
I'm slower. I don't go to the grocery store anymore because people look at me. I have to modulate when I do this, that, or whatever, because people will look at me.
Mm-hmm.
And when they're looked at and there's no cane, perhaps, there's no big scar to society, these folks are just an impediment to our movement through our days. And I think showing grace, I think, is very important.
Yeah, I love that message because I think this applies to everything, right? Like even the people with a cane. I've seen people in the grocery store just get
Yeah,
so irritated that it's and I think, I have that awareness of like you do not know what people are going through.
right.
There's not a t-shirt that says, here are all my things that I'm navigating right now. And I think just this saying of like, if you can be anything, be kind, right? And
Truly,
also just
truly,
knowing,
not just a cliche.
yeah. Yeah. I mean, I'm trying my best to amplify that at all times. And it's hard sometimes where it's like, I maybe didn't prepare enough time. And so the traffic is nobody's responding to the light turning green fast enough for me at that moment. But I also have this awareness that our kids are looking at us all the time to
Right.
model how they should act. Right. So if we say something like, oh man, that lady in the store, whatever, and maybe it is a concussion, maybe it's trauma, maybe it's somebody they love died, somebody whatever, right? It's grief,
Right.
it's so
Right.
many things, it's oppression.
Mhm.
And for us to model that and then be rough about that thing then teaches our kids to be rough.
Mhm.
And I know that I don't want that for my kids. Of I want my kids to be the kind of human that allows them to be the best version of themselves and also treat people the way that they want to be treated, following the golden rule. There's so much to this that I just love of like this grace part. I think it is hard when we can't see what's going on, but also it's none of our business, right? Like we don't need to know what's going on for people. We should just give them grace, right? Just give them the space automatically because we're humans, right? And we're in this together.
We are. And as we're on the verge, I don't know when this podcast will air, we're on the verge of the Paralympics starting in Paris. And folks who have various impairments, physical, mental, intellectual, we're surrounded by those folks. They are us. They're in our families. I want people to show grace to folks in my family who need just a little bit more time. Like you said, even if they have a cane, show them, especially, right? That's an overt. Now, if you see that cane and you're behaving this way, who's got the problem, right? Um, but we are any of us who feel like we are intellectually high functioning, physically intact. One slip and fall, one ill-advised left-hand turn, one inadvertent blow to the head from having those issues.
Mm-hmm.
And I think that I think that it's just so easy to become injured.
Mm-hmm.
And when it happens, like, oh my gosh, but we're surrounded by that. I mean, we are
Yeah.
surrounded by that. We are human beings. We have our frailties, our physical frailties, and we're susceptible to injury. So let's show each other grace. And even if you don't see that, even if it's invisible,
Mm-hmm.
show each other grace. Take a deep breath, plan a longer time to get to the grocery store for traffic, to do your shopping, to get to the gas station, just our day-to-day lives. Don't expect that the line at Taco Bell is going to be one car at noon. It's probably going to be a lot of cars.
Sure.
And so you just kind of take a deep breath, and some of those folks, I promise you, will have some sort of situation they're working through. You brought it up, grief, just day-to-day life stuff, right? Just show grace.
Yeah, I love that message. So back to the concussion part, but I mean, this is all relative to that, but like, how do we protect our kids and teens from maybe getting concussions? Can we? I mean, is that possible?
Well, I mean, you can slip and fall on ice, and you can, just day-to-day life stuff can bring on head injuries, TBIs. But regarding behavior, there, there, this gets down to risk management, right? So, as we talked before, there are certain sports, for example, downhill skiing has a higher risk for concussion and other traumatic brain injury compared to softball, for example. Okay. So a lot of this is managing risk and what you're comfortable with. And that speaks to personality. Some folks are just inherently more aggressive and seek out those sports and impulsive than others. If you go to any NFL locker room, I promise you that there are guys that are more aggressive than others. There are guys in that locker room of whom their teammates would say, like, ooh, that guy, right? And that speaks to personality. And so we gravitate to different things we enjoy doing. Maybe we prefer an individual sport rather than a team sport. Maybe we like that camaraderie of a team sport. And then what are our skills? What are our the genetics plays a big role in sports, but what do we like to do? What do we have fun doing? I think in youth sports particularly, we've gotten way away from fun, God forbid, and learning to what's the scoreboard and the competitiveness of it. You had mentioned when you were in second grade, gymnastics coach sized you up and said, well, we don't have a gymnast here. How ridiculous is that? Preposterous, really. And so, number one, what's your risk? What's comfort level do you have with risk? And I think the child needs to be involved in these conversations as well. I am an advocate for flag football early. If they want to play football, I think you steer them into flag football. That's my view, and I think there's good science related to that. But I think understanding of the equipment and having proper equipment and understanding the rules. It used to be there were basically, sports was more about rules related to scoring and things like that, not necessarily related to prevention, injury prevention. But you can't just whack somebody with a field hockey stick without consequence, right? You can't elbow somebody in basketball now without consequence. You can't spear somebody in football without consequence. So there's penalties related to this. There are also rules. For example, this year in football on a kickoff, which is a horrifically dangerous play, but on a kickoff, the other team, the teams can't move until the receiver has caught the ball, right? And so this decreases these long runs where you can just like lay out somebody who just caught that ball. And so rules are important as well. So parents need to understand risk. They need to understand the equipment, safety equipment related to that sport. And they need to understand the rules and make sure that the rules are being abided by. Not just that the referees are refereeing properly, but that the coach is teaching properly and that the child adheres to that. We get back to personality and aggressiveness. Look at me. I just laid out that quarterback. Well, you got a penalty. And there are consequences to that. And by the way, you injured somebody unnecessarily. So let's talk about that. Let's hit the reset button. And let's not congratulate you for that type of play.
Yeah, I agree. Yeah, I think it's also what we do as parents, right? Of what we are celebrating, right? And because I think a lot of times, like I know in football, for instance, since we're talking about that, like late hits, right? Like
Yeah, for
that's
sure.
incredibly unnecessary
Yeah.
and so dangerous, right? And so it's like, those things should be called. Not that we're yelling at the ref, but we're making sure our kids' coach is supporting following the rules for safety
Yeah.
places, because
Yeah.
you never know when your kid is going to be on the receiving end of that. That might be
Right.
something that is literally life changing.
Absolutely.
Yeah. And I think, and also being maybe an advocate for changing the rules. Like if you see something dangerous that's happening, be
Right.
somebody who says something like, hey, that's really dangerous. Do you, coach, what do you think? Or talking to whatever the entity is for that particular sport to say like, hey, what are we doing about this? Like, this is dangerous, and to keep people from being injured, because really we just want our kids to play and have fun. That should be the goal, right? And learn something and grow as a teammate, right? Not just doing everything themselves. Like there's so many valuable things that I think that can come from sports, playing and team mentality, even individual, right? That we can grow there, and that we're not really, I mean, we are competing, right? And I understand that that's part of it, but really in life, most of us are not going to be professional sports players, right? That doesn't mean don't try, but that also means that we're all going to be doing something else. And if we can avoid a concussion or a clavicle fracture, or, some other major laceration or whatever that happens, let's do that.
That's absolutely right. And what you're speaking to in my vernacular is really the culture of the team.
Mm-hmm.
What is the culture of the team? Are we going to celebrate late hits? Congratulate? No, come here, come here. You're standing right by me. We're going to talk, and you may not get in the game the rest of the game.
Mm-hmm.
What you did was wrong,
Yeah.
right? It's against the rules. Your team was penalized because of it, and somebody else was injured. So what's the culture of the team? This
Mm-hmm.
is paramount. And parents, I think, should be empowered to say, you know what, the culture of this team is not one that we promote. And so you don't get the privilege of coaching my daughter,
Mm-hmm.
my son, because there's other coaches out there for whom the culture of the team is empowering and affirming and promotes confidence and self-esteem. And I think then especially in youth sports, that those should be the goals.
Mm-hmm.
And certainly not promoting playing against the rules and celebrating that, because the rules are in place in large part, not just to diminish a competitive advantage, but to protect the players on both
Yeah.
sides, on
Yeah.
both sides.
Yeah.
And so when kids know this too, they know if they're having fun, they know if that coach has their back.
Mm-hmm.
I care about you as a person. I'll have athletes in my office who will say, you know what, coach has never called me. Coach has never called me to see how I'm doing. What message is that?
Mm-hmm.
And I'll say to them, so when you grow up and you become a coach, are you going to be like that? Like, no, they learn, they know who really has their best interests at heart. And so that speaks to the culture of the team. We're going to play within the rules. We're going to promote each other, build each other up. We're going to be a team, all the great things that sports can provide. And then, as you just described, kind of the underbelly of sports, right?
Yeah. Yep.
Yeah.
Yeah. And I think, yeah, this is such a good topic to have. And I think it relates to concussions, because sometimes that's how they're happening, is these late hits, these, the educational part of sports. Coaches have such an important role in this, to make sure that their player is, if they're headering the ball, if that's something that they can do, is doing it functionally in the best way for them, right? And also might say, we're not going to do that. The research really doesn't support that this is really good for our teammates. Sure, the other team may do that, and that might give them a competitive advantage. But I care about your kid as a human, as
Right.
a person, as a real life force, versus being just somebody who's helping to get us to the winning score or this winning reputation. But it's just so much more than that.
So in soccer, for example, heading the ball carries with it increased risk for concussion. Part of that is just how good your neck stabilizing muscles are, how your skill is in heading a ball, and also then the impact of somebody else who's trying to prevent you from heading the ball, right?
Mm-hmm.
And so head-to-head injuries, heading the ball, we know that these are increased brings with it increased risk for concussion, for head injury, which is to say the obvious, right? So U.S. Soccer has rules related to heading the ball, depending on your age. And that is a rule directly related to promote the health and well-being of the athletes, to decrease their risk for head injury.
Yeah, I think it's important. Yeah. Okay, so I feel like I know what the answer to this is going to be, but one of the questions that has been asked by our audience is also, what do you think is the biggest misunderstanding around concussions?
That everybody makes a full recovery.
Yeah.
Yep, by far. I will have patients on a day-to-day basis who will say, I had no idea this is what a concussion is.
Mm-hmm.
And they're, you know, by and large, they're recovering, they're improving, but they'll be like, I didn't think it was like this. And they may say, because we've talked some about football, well, you know, they all make a full recovery. No, they don't. No, they don't. Every year people, football players retire because of concussion. You may not hear about that unless they're a star player, and unless you're doing a deep dive into the, you know, the rosters, they just quietly retire because they've had too many. And so that is to me, the biggest misconception.
Yeah. Well, thank you so much. This has been another fantastic
Thank you.
conversation. We so appreciate your words of wisdom and all of your advice, Dr. Lori.
Well, let me say, Bryce, I appreciate this immensely. And I really appreciate the expertise you bring in helping folks, particularly young people in the Kansas City area. So
Well, thank you.
Really appreciate that. I think you're at the top of your game.
Thanks again, Dr. Lori. You, as always, are a great guest, and thanks for entertaining all of our questions. We really appreciate your thoughts and words of support and encouragement, and also just knowledge on this topic. Thank you so much for your time today. We would love it if you would rate us, subscribe to our show, follow us on Facebook and Instagram and YouTube and TikTok, and also keep the emails coming to accidentalexperts@gmail.com with your topic requests. Have a fantastic day. Some words from our legal team.
The information presented in this podcast is not intended or implied to be a substitute for appropriate professional advice, diagnosis, or treatment. All content, including text, graphics, images, and information contained on or available through this podcast, is for general information purposes only. This podcast makes no representations and assumes no responsibility for the accuracy or information on or available through this podcast, and such information is subject to change without notice. You are encouraged to confirm any information obtained through this program with other sources and review all information regarding any condition or treatment with the appropriate professionals.
What we're saying is, yes, I am a real therapist, but I'm not your therapist.